Not even the record-breaking heat that covers the island during the summer months could have hindered the myriad of male patrons from receiving free medical assistance at the Men's Health Fair at Turtle River Park in Ocho, Rios, St. Anne in May 2024. Let's recap the summer activities as the sunny season comes to a close. The fair, organized by the St. Anne and St. Mary Division of Jamaica Cancer Society in collaboration with the NERHA, Northeast Regional Health Authority, provided services ranging from basic medical care, such as height documentation, to more detailed procedures. Join PBCJ as we share a brief look at the Men's Health Fair. Pleasant viewing. Studies suggest that Jamaica has the highest incident rate of prostate cancer in the world, with an age standardized rate of 304 per 100,000. This means 304 out of 100,000 Jamaican men of a certain age can be diagnosed with the disease. The starting age of men generally diagnosed with prostate cancer is 40 and over, but although the probability may be low, men younger than 40 years old can be susceptible to the cancer. Within the Jamaican landscape, there are medical professionals seeking to address the long-standing concern surrounding the disease that primarily targets men, and are taking initiative to not only bring awareness, but aid. And through this desire, events such as the Men's Health Fair at hand was created.
We're seeing a lot of advanced cases of advanced prostate cancer in St. Anne St. Mary men. Started with Dr. Marie Brown, the consultant urologist at San Jose Hospital, when she formed the clinic there, the urology clinic. We never had a urology clinic before. And when she came in, she was really seeing that our St. Anne and St. Mary was in a state. So she approached Jamaica Cancer Society, our St. Anne St. Mary local branch, and asked if we could partner to do something. And we came up with the idea together with her to start a men's only health fair initiative in St. Anne.
If one can, why not hear it from the horse's mouth? Or in this case, the urologist.
When I came to St. Anne in March of 2022, and I realized the advanced cases of prostate cancer that I was seeing at the hospital, and even privately as well. And I thought at the time that we needed to have a more rigorous screening for prostate cancer. So I contacted Jamaica Cancer Society, St. Anne and St. Mary branch chair, and we had a meeting, and that's how the Men's Health Fair was born.
As the old Jamaican saying goes, one hand, car clap.
And it's like a no-brainer. You have to be involved, because at the end of the day, the problems will come back to, haunt us or plague us in a sense. And part of our duty as healthcare professionals and providers is to be involved in preventative care. And today is a day for preventative care. We're screening for prostate cancer, we're screening for other forms of cancer. We're looking at the numbers of people. When we say know your numbers, meaning your blood pressure, your blood sugar levels, cholesterol levels, all these things that ultimately down the road can cost the nation a whole lot and cost the people's families, the patients' families, a whole lot. So as they say in Jamaica, an ounce of prevention is more than a pound of cure.
And we are seeing appreciation from the community for the initiative.
I'm particularly excited about the turnout today. I understand that we'll have over 400 to 500 men that are coming here, and the demographics are important because most of the men here seem to be over 40 years of age. And I understand that once you reach 40 to 50, they start screening for what is essentially cancer, and the male cancer, the cancer that is really an athlete's heel of most men over the age of 40 to 50 is prostate cancer.
Within this appreciation, there is also a significant question that is being posed.
Only one problem I find, one problem I find still is how is it not properly funded on a bigger level?
Initiatives such as the Men's Health Fair are vital to a community, but in turn, it requires the community to support it. A reciprocal relationship is crucial for its survival and for it to meet its core objective: to aid in men's health.
There needs to be more interaction between the business community. And it doesn't have to be the large business community. It could be, mid-tier and small enterprises also.
In all facets of life, we need support. We can't do everything for ourselves. This is why it is important to have agencies and companies fueling these projects. In the midst of this reality, however, we also have to realize the onus falls on ourselves to seek betterment when others play their role.
There's a culture in Jamaica that men are afraid of the examination, the digital examination, and quite honestly, it's something that you have to do. And as mature men, you really shouldn't be afraid of something like that. Recognizing that life goes on, and once you reach a certain age, you need to start taking care of yourself and taking these examinations.
When we fail to realize our roles and responsibilities in our own lives, we quickly see how it affects community and country.
The cost of it is significant because the country as a whole cannot afford to have all of these men in terms of the productive base of the country, men who are these are men who are working men, who have big responsibilities, they have big families to take care of, they have their companies to take care of, their businesses to take care of. So they have big responsibilities. So it's devastating to the families and to the economy itself if they don't take their health serious. And at the same time, the country as a whole cannot afford that heavy medical cost to have men, put away in a hospital for, plus the radiation and the chemotherapy and, the cutting the prostate and all of the medical things that you have to do to try and get rid of the cancer. That comes at a cost. And with our socialized medicine as we have it, it's a major strain on the country's health bill. So we need to really, it has so much implications.
With change in our mindset and active participation, we bring awareness. With our presence, we bring exposure to further enhance the capabilities of the very thing we've benefited from.
Jamaican men have very poor health-seeking behavior in that they are unlikely to seek medical help at the first sign of any symptoms. They would prefer to try alternate medicine or bush medicine as we call it on this side. However, with this health fair and the third year, we've seen a lot more men turning out, so they're taking their health more seriously and they are open to the advice that we're giving them.
As Jamaican men become more aware of their health and the health concerns, there is imploration to take their health more seriously.
Typically, Jamaican males have always been afraid of the doctor. And, the wives come in to see me and they tell me, oh, they have to almost, dig out their husbands to come. But I think because of public education and because of activities such as what we're having at Turtle River Park today, and because of folks like yourself in the media who, provide this platform to broadcast it, more and more men are becoming sensitized to the need to really get on top of their health, and they are beginning to see the effects of good health care. In other words, many men in the community are seeing other men who took too long and the suffering is great. So they realize that we must all die, but at least we can reduce the suffering. And I think these men nowadays are recognizing that they gotta be brave, they gotta man up, come, get their checks done, and as such, they'll prevent themselves from suffering too much in the end.
We are imploring men to come out, to take their health seriously. It affects the families, it affects the loved ones.
So I want to take the opportunity to implore to all men, all Jamaican men, take your health seriously. It's your health household. Your father, your husband, your brother. Take your family seriously. Take your health seriously. Get tested. Man up. That's what we say. Man up. Get screened for prostate cancer. We have the highest death rate in Jamaica. Number one cancer among men in Jamaica. But we all ask men to get screened. Man up. Take your health seriously. So I appeal to the men, come out, get screened. Not just today, but right throughout the year. On your birthday each year, go get your prostate checked. Get your prostate checked. It's a simple test. Get your prostate checked. Man up. Man up, Jamaican men.
This has been the coverage of the Jamaica Cancer Society, St. Anne and St. Mary Division Men's Health Fair. I'm Raquel Robinson. Thank you for watching.